Today our talk is the role of RF and microwave devices in biomedical. And our distinguished speaker today is Dr. Abdulrahman. He earned his Ph.D. in electrical engineering from the University of Queensland, Australia. And he specializes in the design and development of wearable RF electromagnetic-based biomedical devices for brain imaging. I hope we'll see a brief of that today, a glimpse of that. With a decade of experience in academia and industry, including 2 years at Australia, he has a solid foundation in teaching and conducting cutting-edge industry and academic research. His work has earned multiple awards, including the 2021 prestigious University of Queensland Award of Outstanding Research Theses and numerous scholarships from prestigious institutions. Without further delay, I will hand it over to you.
Thank you very much. Assalamu alaikum wa rahmatullah. And thank you for attending this seminar. Inshallah, today we will explore the advancement in radio frequency and microwave technologies in biomedical applications. This seminar will not be technical, it's more about the applications and advancement in the field. So it shouldn't take long, inshallah, 30 to 40 minutes, and 20 minutes for discussion. So let me start by giving you a broad picture of how microwave and radio frequency are currently being used in biomedical application. So as you can see in this slide, it's spanned from the diagnostic to treatment and therapy, monitoring and sensing to wireless power transfer and communication. So for example, if you look at the first domain, the diagnostic, it has been explored mainly, if not already been utilized, for breast imaging, cancer detection, head imaging, stroke detection, skin cancer, lung cancer, and etc. For treatment and therapy, some of these technologies are well established and being used in the hospital, for like the RF microwave ablation technology. A lot of effort for making it as a stimulation tool for brain activity, different diseases related to brain, and also in monitoring. You can see the telemedicine. I think everyone is very familiar with this one, especially during COVID, which you can't see the network physically. Wireless body area network. This one is well established and a lot of data and prototypes and experiments in wireless body area network, and it's being utilized. Wearable RF sensors, a lot of wearables, especially nowadays. The wearable technologies paying a lot of attention. You can see it's, you know, from the watch to sensors to different, and it can be used for different applications. Implantable devices, biosensors, in wireless power transfer and communication, charging implants and wearable. This one is also getting a lot of attention recently because there is a focus on implantable sensors, and these implantable sensors, one of the main challenges is the battery. So with using wireless power transfer, it can be battery-free sensors. So it's very, very interesting topic, and it's being explored by a lot of researchers recently. So let's just start with the first one, which is the diagnostic application, to dig into this and see what is the advancement and what is the state of the art in this field. We will discuss only two due to the time limitations. You can't go into each one, but we will discuss the two widely explored in the last 2 decades, which are the microwave breast imaging for cancer detection and also the microwave head imaging for stroke detection. But before we dig into this, just a quick introduction about what is microwave imaging. So microwave imaging is an emerging medical technology with non-invasive, non-ionizing features, and it uses low power electromagnetic signal, and usually it's operate at 0.5 to 10 gigahertz to create an image of the internal tissue of the human body. Somehow it's alternative or something very similar to the MRI and CT scan that well known and exists technology. This technology is mainly relies on the contrast or the differences between the dielectric properties of the healthy tissue and unhealthy tissue. We know that the scattering and reflection is a function of the dielectric properties of the material. So when there is, for example, abnormality inside, let's say the brain, let's just take the stroke as example. The dielectric properties of the stroke is different from the surrounding tissues. So the scattering and reflection from that specific region will be different. We take the advantages of this contrast in the dielectric properties to identify and locate the stroke. Same thing. This is the main idea or the general idea of the microwave imaging. The system is usually simple in this technology, which will consist or usually consists of antenna array configured around the object, connected to the transceiver, and also the image processing unit and display unit. How it operates, the transceiver will generate the pulse, send and transmit through the antenna into the body tissue, collect the scattered and reflection is based on the what image processing algorithm you are utilizing, and then it's just processed that scattering that and reflection, which carry useful information about the internal tissues, and just display the image with this area, for example, this scattered in the affected area. And there are two types of image processing algorithm. One is the wideband radar based, which is inspired by the well-known radar technique, and the microwave tomography based. Each one has different specifications and different features. For example, the wideband radar based is very simple one, and it can generate the images within less than a minute, let's say, in most cases, or it can be in seconds. Microwave tomography based, it's based on the forward and reverse electromagnetic problem. It's very complicated and it requires a lot of computational process. But the difference between this two, this one it's remap the whole domain, the whole image domain, remap the dielectric properties. For example, it will construct the image domain with the dielectric properties, include the affected area. For example, if the affected area has a contrast in the dielectric properties, it will show that affected area with different dielectric properties. And that, converted to images, then you can see clearly the areas. So in terms of information, this microwave tomography provides more information. This one is easy, less computational process. But it will just show you the scatter only, it's like a dense area. And in most cases, for example, there are a lot of type of cancers, different type of strokes. Then using this one is bit, it can show you there is a target or there is abnormality, but what type of it? So that is the drawback of the radar-based imaging algorithm. But anyway, that is just a brief introduction. If we want to dig into those techniques, multiple seminars. But let's just move on to the microwave breast imaging, which mainly for cancer detection. And as you can see, the aim of developing the hardware is to maximize the electromagnetic wave penetration into the body tissue or the breast tissue, and get as much as possible from the scattered and reflection signal. Then process that signal to identify or should be the abnormality inside the breast. This technique is very widely explored, and it was one of the first to be employed for or explored for imaging for the microwave imaging to be explored for imaging the internal tissue. So if you can see, this is the development timeline starting from 1999 to 2025. 1999 up until 2004. This is the first effort led by Professor Susan Hagnes at University of Wisconsin-Madison. She published early work on ultra-wideband radar-based imaging in 2002, and that was among the first people who explored this field. Until 2004, all the exploration and discovery was just based on numerical and simulation. Then this topic gained a lot of attention from different researchers across the globe, and it became like a hot topic. So from 2005 to 2015, it became of hundreds, if not thousands, of research groups start to investigate different hardware design, different algorithms, and designing a lot of prototypes, publications, and so on. However, only a few groups that continue or progress to the next. Most of this effort was just investigation, exploration, and publication. This from 2016 to 2020, few groups we will discuss in the next slide, that they progress to preclinical trials. And we will discuss at which stage is now this technology. You can see those are among the groups that they progress to the clinical trial. This one is a research group, electromagnetic research group at University of Borgia, Italy, which have partnership with the UPT company, and they developed what they call it mammo-wave breast cancer detection system. This system just it's faulty, to be honest. And one of the advantages of the electromagnetic wave or the microwave imaging system is to be portable as possible. This is still like faulty, still with a man leg or human size. Anyway, they have designed this and they have run several clinical trials. Latest available information about their clinical trial is here summarized in this graph. They stand around 1024 samples. Detection, they concluded up to 80% accurate with comparison to the mammography and other technology that we use. Another group that they progressed to clinical trial is, did I move one? Yes, this one is the another one, which is Wavilia. They call it a device, Wavilia microwave breast imaging cancer scanner. It's from Microwave Vision Group, France. Their device is also being tested and through a multiple clinical trials, but they didn't disclose the latest clinical trials. They have only disclosed one clinical trials for around 24 patients, and they achieved detection rate up to 87.5. The third one is SAFE. This SAFE, it's stand for scan early for early something, but the name of SAFE, it's short word for scan early for early detection. I can't remember exactly, but they name it as SAFE, and it's came out of Istanbul Technical University, and Marama University in Turkey. So they have partnership with this medical technologies company, and they built their safe breast imaging scanner. They have conducted multiple clinical trials. First clinical trials was for 115 patients, second one 113, and latest one was for 59 patients with success with a detection rate of 81, which is very high percentage. But you can see that the detection rate is moved from 63 to 81 by integration of some AI into the system beside the image processing algorithm. The next one is the microwave head imaging post-stroke diagnosis. I'm very fast with this one because I spent 4 years doing my PhD doing this one. I have talked more about it during my previous seminar. So for those who are seeing this as repetition, forgive me because most of the attendees today they didn't attend to that seminar. So microwave head imaging for stroke diagnosis, another very interesting. There are MRI, CT scan, but why only for stroke? I mean, specialized. Most of the researchers are targeting the stroke because stroke is it's a very it's emergency case, and based on the a lot of available data, the stroke patient need to receive medication within 4 hours. If they delay after 4 hours, possibility of death or long or permanent disability is very high. So the faster you treat the stroke, the high possibility of fully appearing from the stroke, and no other liability, for example, the long-term disabilities or so on. So they target the stroke to have, and currently the MRI and CT scan being used for this one, but they are not available everywhere and expensive, especially for countries that have very good land and territory. They can't have those technologies everywhere in rural areas, for example. It's only a small medical centers. Then they saw this one as an alternative device that can be employed or deployed in small clinical trial, ambulance, anywhere. So it gained a lot of attention and a lot of funding from different stroke foundation centers. So the stroke is generally started in early 2007 to 2011 as exploration and investigation. It's something like what we mentioned for the breast imaging. At this time, they just moved to investigate how this technology can be used for stroke detection. And mainly until 2011, it was just based on simulation, numerical modeling, and no prototype yet. From 2012 until 2017, a lot of researchers involved and developed a lot of prototypes and investigated a lot of different type of antennas, system configuration, image processing algorithm. However, only currently a few research groups that they continue. So we will see what is the current status or the state of the art for this technology. The preclinical trials mainly led by the University of Queensland, Australia, King University, and EM Cancer. They have partnership, and also the Chalmers University of Technology in Sweden. The first one is, let's just look at the effort led by University of Queensland, leading by Professor Amina Bush, who is the lead of electromagnetic research group at UQ. And he started as early as 2014. They built several stroke imaging or the stroke imaging system based on free space. We call it based on free space because they used to have different type of configuration where they build the antenna at some space from the head, and they leave like a free space between the antennas and the head. So they call it free space-based imaging system. They built more than 6 prototypes, but their attempt were not successful until that stage, because the main issue or the main challenge was because of the free space or the skin and free space interface reflection. As we know that the human tissue in general is lossy, and the weight tends to be buried inside the human body. But because here we have the free space, the electromagnetic will hit the skin, and there is a huge differences in the dielectric properties. Free space is 1, skin is around 40. So most of the reflection will occur at the skin air interface. And then that reflection from the skin overlap with the reflection from the internal tissue if there is, for example, abnormality. The reflection from the abnormality considered very tiny compared to the reflection from the skin. So there was no progress toward clinical. They used to generate some images using identical or we call ideal reference. For example, you scan a head and you bring the head, put the target inside it as a stroke emulating target, and then just subtract everything and you get that image. But that is not practical because subtracting in the real case, for example, with patients, you can't have access to the exact healthy head of the patient. So it was big problematic. So then there was a proposal to have to design a wearable system that will eliminate this free space area. And we started by building the wearable system. This was part of my PhD research project. We built different prototypes, around 4 prototypes, to prove the concept of wearable electromagnetic imaging system. We succeed in minimizing the reflection, the free space reflection, and enhance the propagation into the human head tissues. And we get a good reflection from inside, from the internal tissues. But there was some issues regarding the movability of the antenna, sensitivity of the bending, and so on. However, we worked hard long 4 years, 5 years at UQ. It's not only me. We have a large team, around 14 people, to progress forward clinical trial, and we succeed. We succeed in that, and we have attract one company to come and sponsor this project, which called BioEngage Medical Devices, and we work together with BioEngage Medical Devices to build the first ever clinical trial device. So we were successful to build and push that technology to the first ever clinical trial for this technology at PA Hospital in Brisbane. This is our first clinical prototype. It's just, we took the consideration of using it in hospital. For example, if you see, we moved from small or lighter wearable cap. Sorry for this, if you can't see, I can jump to this. So we moved from the previous one, it's a wearable lightweight cap, to a bit bulky cap, just to consider the radiation and interference with other medical devices. We felt a lot of what inside this cap is 16 antennas, absorber to shield the internal signal to not interfere with any other devices in the hospital, and also the other devices to not interfere with the electromagnetic system, the head scanner. So at the end, we end up with this design. We tested it for around 50 stroke patients. We got around 80% accurate what we used to do, I was involved in that trial. We used to scan the patient using the MRI, not us, the radiology. Then they bring it to a room. We scan it using this device. Then we compare the MRI with the output of the head scanner. And there was 80% successful detection. 80% of the cases that I have on some photo. Yes, here is one samples of the detection or the images that we used. For example, if you see here in the left side is the MRI and CT scan, and left side is the output or the image reconstructed by the head scanner, our head scanner. At this stage, we hand over everything to EM Vision Medical Devices. They took over, they buy the IP from the university, and now they progress to develop this device. Now this device at this stage, now they call this one as Gen 2, and this one is Gen 3, which is a smaller one. It's a wearable, not wearable, but it's a lightweight and it's customized to be for air ambulances, for the airplanes, to be placed in the airplanes, and also for the ambulance. So this one is movable and portable, can be go anywhere. That one is proposed for clinical, for medical centers, small medical centers. The next effort or the another effort led in this field is by Professor Simino. Yes, Simino from University of Kili, UK. And he actually started up this company, EM Tensor, and he went through multiple prototypes that called Gen 1, Gen 2, Gen 3, and now he's at Gen 4. There is no information about that. He performed some clinical trials, but I have searched. It's like confidential, I'm not sure. We couldn't find anything. We used to watch this guy even during my PhD. You know, both of us working on the same thing. We watched to see what there is, what their newest thing finding and so on. And the same thing we used to watch it. But so far, I haven't seen anything related to these devices in their website. The website is EM Tensor, that is the company, but they didn't disclose much information about it. The next one is an effort led by Chalmers University, led by Professor Michael Benson. And this device actually is quite old, but it's not microwave imaging exactly. This device consists of 8 antennas, and it's just show you a graph. It's not meant to generate images. It's meant to generate a graph or just to tell you if there is stroke or not. So it's based on graph. For example, they just measure the reflection, and based on the reflection, if it starts threshold, they say, oh, you have stroke, and it can't localize it. So it will not show you where's the stroke located inside the brain, because there is no image to generate it. It's just like, yes, you have stroke or you not. So, but however, they did some clinical trial in 2019, and then they stopped the development. Most likely the clinical trial was not successful or something, but they totally stopped developing this device, and it stayed at that. No progress. Okay, let me just move quickly because we still have only around 7 minutes. Let's see what is the RF and microwave in treatment and therapy. One of the well-established and being utilized now in hospitals is the RF and microwave ablation, type of thermal ablation techniques used in medical treatment. This technique is used to treat cancer by heat. And there are 2 types. One is RF, which they just use low frequency around 300 to 500 kilohertz, and that is used for small size cancer. And the another one is the microwave, which utilized microwave frequency from 900 megahertz to 400 to 1450 megahertz. This one is usually generated microwave generate higher temperature, 80 to 150, and the one is 60 to 100. So they usually treat the serious or the aggressive cancer using the microwave one, and this one for the smaller or at early stages. As you can see, the technology is very simple. This is the antenna, and it's invasive. At the affected area, they stop generating the electromagnetic wave pulses to heat up that area and kill that cancer. The another one is brain stimulation, which is kind of therapy for a lot of diseases, include Alzheimer. What is this technology about? It's just consists of coil, electromagnetic coil, to emit signal or electromagnetic pulses into the brain to stimulate the neural, the brain neural inside the brain, and it targets specific position in the brain based on which nerve or neural is which neural is responsible for which activity. For example, Alzheimer, some neural is responsible for this one, or deactivating or inactivating this neural could help to stimulate the activity of the brain. So this is the idea of it. It's a kind of electromagnetic. Here, some research done by my colleague, Rawan Yusuf, at the University of Queensland. She developed an array of coils, around 8, in aim of maximizing the penetration. The same thing exists in all the RF implantable or any RF interaction with human body. The main challenges is how to increase the penetration into the human body, because the human tissues are lost and they tend to attenuate the signal. So maximizing the signal to reach to deeper inside the brain and to specific area inside the brain was one of the main challenges. This research was aimed to maximize the signal and the concentration of the signal into the brain to improve the penetration. She did a lot of measurement on Bagel. That one is listed showed there, and she actually proved that the multiple coils, the array, it will indeed increase the field concentration or the field distribution inside the brain from the simulation result. What else? The next one is wireless monitoring and sensing devices, which include wireless body area network, which is a network of wearable devices. And this is the future, actually. We will, end up wearing a lot of devices communicating with each other and to other devices. This one is very related to Internet of Things, for example. And it's well progressed and well developed. Implantable sensors with RF telemetry. This one is a type of sensors that is inserted into or inside the human body. And there are a lot of implantable sensors. And some of them are based on the RF and some of them are based on other technology, but the RF is part of it. For example, in this implantable pressure sensor to monitor the patient with heart failure, pulmonary arterial pressure on the patient with heart failure. This one is based on the capacitance and inductor, because we know that there is a relationship between the capacitance and pressure when we design it to suit the valve. the application. The capacitance is variation. The capacitance variation is proportional to the pressure, because the capacitor will have two plates and distance, and anything between the plate will affect the capacitance. So the idea of this one, they include the capacitance pressure to monitor the pressure, and also the another interaction or the another application of RF here is the LC resonance circuit, inductance and capacitance resonance circuit, which designed to couple the electromagnetic signal to outside. So this one is to power the sensors and communicate to external, and also part of it is the operational principle of the sensor is based on the capacitance and inductance. Charging, and this one is the last domain, which is wireless power transfer and communication system, communication between the sensors. This one also, as I mentioned in the beginning, it's very important because we expect a lot of implantable sensors within our body, and there will be, instead of off-body communication, for example, the current wireless body area network, it's mainly wearable sensors to communicate with that. But in the future, there is focus or some movement toward implementing the sensors inside the body, under the skin, and under. So those sensors, with nanoscales maybe or bigger, may power. How to power them? Power, as I mentioned, it's one of the challenges. So charging those or powering those sensors using wireless power transfer, again, for example, by harvesting RF, electromagnetic wave, will be the future of this technology. But currently, they use them. I mean, they use it for example, one of the sensors that is Eversense implantable glucose sensor. The principle or the operation of the sensor itself, it's not RF because it's some chemical reaction or something. But how they power it? This one is under the skin, and it won't last for 6 months without batteries. It's passive. It's only powered through the electromagnetic or the wireless power transfer. They have like device to power it, and that's it. It will be on. It's not fully passive. It will need to power using the power wireless power transfer. So the future trend, we will see IA interacting with a lot of RF applications or biomedical applications. For example, AI, sorry, it's AI, not AS. AI-driven RF diagnostic. We can see that AI is enhancing the image outcome based on the. It's not well studied the AI in the microwave imaging, but it has some part of or some integration with some of the technology. But with the advancement in AI, we will see a lot of enhancement, and those technology that they start at some stages by different, from different researcher group, we could see them now progressing with the AI. It might be another turn to try to implement those diagnostic RF-based method using the AI. Self-healing RF bioelectronic future development of RF circuit made with self-repairing material for long-term implementation. Now, the trend is also to maximize the battery. One of the things, the self-healing, for example, a lot of exploration for different material, 2D material, graphene, and so on to be utilized in RF. RF controls now tri-capsulate. There is some research now going on to design a small smart pill and to be adjustable into the body and to control the drug delivery to a specific part of the human body. Wireless body integrated network, wireless body area network, which I have talked about. Thank you. It's
Thank you, Dr. Abdulrahman. I think we'll have questions. So this if anyone has any question.
yes.
Okay.
Thank you, Dr. for your presentation. The cases that you mentioned for the microwaves that are used for diagnostics, they have various optics like we have optical and therapies. What is the distinct feature that we can say about microwave that make it very good for diagnostics?
Well, the microwave has few advantages. One of them is the low cost. As you can see, the system is just a system of antennas, transceiver, and with the advancement in the electronic and so on, the transceiver getting smaller and smaller. And the other thing is non-invasive. The other part maybe it's non-invasive as well, like MRI, but non-ionizing, which means that it can be re-screened frequently. For example, it can screen in the morning, at night, and so on. The easy access to this technology will make it easy to rescan and access it. The another thing is what was that? Sorry.
Yeah, thank you very much. I'm not expert in this, just a question. No, but they have been using ultrasound for patient monitoring. Why they doing MRI and microwave stuff? I mean, are there any drawbacks or the limited capability?
Definitely, there is a limited capability. Ultrasound, I think it's only I'm not expert as well in ultrasound, but they usually use it for soft tissues. Yes, I'm not very sure about it, but it can be used for head scanning. It's only now currently the MRI and also the CT scan that can detect and localize the stroke, for example. For the breast imaging, I'm not sure about the ultrasound, but most likely due to the type of the tissues, I think it's not being used. Otherwise, the ultrasound is a great technology. It's something that what we are trying to have for the stroke detection is something like ultrasound.
Just a comment, just like I said, I'd like to mention that we have excellent collaboration with the biology department, the lifting engineering department. Currently, there is an experiment going downstairs, I think, making brain monitoring system, Dr. Brain 9 and one of the graduate students from the Bioengineering. We hope we have a microwave network analyzer that goes up to 50 gigahertz, and we have a couple of sensors. So I think we would love to have new collaboration with the Bio and the HRD around this, that to continue to work on that. We have another big monitoring system to measure the pulse oximeter that is working on that company. We have also made a wireless heartbeat breath monitoring system, which is another basic. So inshallah, we'll continue to
That's very good. Thank you, Dr. Ali. That very good news that we are growing up on the biosensors and biomedical application as well. So yes, we love to collaborate with bioengineering, of course, to provide and with others.
I think also we can contribute not only to building devices, we can contribute to understanding of and even contributing to the diagnosis. Just to give a quick story, one of my difficult times in my life, I had a baby, my wife was pregnant, so we went into the hospital, and there was a little water in the room. So the diagnosis was the baby has no legs. So they told me the baby has no legs, no legs. And they checked again, another expert, they said he has no legs. And the reason was there was little water. So being electrical engineering or bioengineering to understand that the electric constant will not be different from different parts of the body. So lack of knowledge of electromagnetics and this results in the wrong diagnosis. So I think we can contribute not just to the devices, to the reading of the result.
That's true. We can contribute to the knowledge of because this field, as Dr. I just mentioned, it's not well explored. The interaction of electromagnetic with different part of human body. It's explored, but it's limited in the knowledge. If you are going to look for some specific dielectric properties of some part of the body, you can find it. There is well established, but the interaction with the electromagnetic and different antennas, different frequency band, and so on. Thank you.
Okay, so Abdulrahman, just a follow-up with Dr. Ali. I think now the university is investing a lot in bio research in Dubai. And this is very clear combining department and the systems and also all other activities going on with this one. So this is, I think this is nice because it comes with a lot of opportunities and it is impactful. And we used to do some work there, but it's like scatter. But now there are a lot of efforts into this direction, and it's an open invitation to all to collaborate and in this direction. Just maybe one technical question regarding the sensors, because you apply, for example, to the brain imaging, and even in the breast cancer and others, there are a lot of sensors, or let's say antennas.
Yes.
So how they are operated? So they are they operated in one time, or they are in different phases, or how
Okay,
they operate?
Yes. To construct the image, there are two approaches. One is the monostatic. We use radar-based imaging, but with advanced algorithm. But the operation was using bistatic, we call it. One antenna will transmit a pulse. The rest, for example, in one system, it applies 24 antennas. All those antennas are connected to the transceiver, which is PNN, multiple network analyzer. So one antenna will send, the rest will capture the scatter, and then it will turn to the next one, and this happening in microseconds. The next antenna will transmit, the rest will receive the scattered signal, including the scattered from the and the another approach is the monostatic, which is each antenna will send and receive. But that will limit your information. The time is not actually the issue. The issue is that will limit you to the reflection only, because one antenna will send to the pulse and receive the reflection. But with scattering, you will receive a scattered signal from each antenna, so more information to process.
This applies to all those like brain imaging to this cancer.
Yes, all it's the same operating.
Any question?
Yes.
Follow-up questions from one of the questions that's raised. So, there was a slide where there was a comparison in MR image and microwave.
Yes. Yeah, this one, right?
Yes.
Yes.
So, I think in the microwave imaging,
Yes.
it only detects the abnormalities, right?
Yes.
So, because it's different from the MR image, because there is some activity, some other
Exactly.
activity going
Yes.
on.
Yes. Yes.
So it's not really to monitor the regular activity of the brain, it's just tells if it's like normal or abnormal.
Exactly. That's the limitation of the microwave imaging. We will never reach to MRI resolution. MRI resolution it's something like magic, because it gives you the internal tissue as is. But what this alternative technology can do, it's just tell you. We are, for example, the doctors who is specialized in this. He knows about everything inside the brain. He doesn't care about everything here. What we just need to know is there stroke, where is the stroke, and what type of the stroke. So the microwave images will always be like this. It will not be like a detailed internal tissue images.
So even with improving the interaction with the skin or whatever tissues there is.
Even, yes, what is the improvement is to just to get a clearer resolution of the target only. And if, for example, if the target here, you can see the target is shadow, it's just very close to the skin. This one is easy to, for example, for the microwave. But what about if the target is inside, in the middle of the brain? Then in that case, is challenges for electromagnetic. Utilizing this type of, or minimizing the reflection from the air-skin interface can enhance the penetration until the, for example, the center of the brain.
Okay, well, I'm supposed to take 1 hour for a presentation.
Using this device, we used to scan in 30 seconds, including putting the device and setting up in the screen. And, it was automated measurement. It's just to press in the skin measure, and it will calibrate twice, and then measure for around 15 seconds to put the measurement. The whole process is 30 seconds.
The patients move in
No, he must be lay down and he must be still.
but sometimes the eye, they move.
If moved, what was integrated by the image processing algorithm team, if there is any movement, it will show you an error here. So they will detect there is a movement and the response of the antenna will not be stable. And based on that, they have just integrated something, AI mainly, to say there is error. So we used to have only to proceed with the measurement if there is no error. And if it moves, error will appear in the screen and rescan again.
But the method seems to be safe, right? So
It's-
incremental,
Yes.
so that's one advantage of it, right?
Yes,
In
saver.
addition to
I was
portability.
trying to remember one of it, it's saver. And that's why I said it can be repeated, you can understand. Because what we used is around 10 dBm, 10 dBm. So it's somehow like what we used for, or even less than what is our handphone is utilizing currently.
Okay, very good.
Has it been commercialized?
Not yet, because you can see what I mentioned here. Now the system is shaped to US University of Texas Health Science Center for to support the FDA. They still trying to get the FDA clearance before start to commercialize it. So hopefully, if they success at this stage, then they might. But if not, then we will lose everything.
So you have any share?
I have very small, because it's owned by university actually.
I'm not looking for something. I thought that's right.
Well,
I just throw it.
Okay, thank you very much. We have to be to the time. Thank you very much.